Mark and Sharon Lamond are honored to chair the 21st Annual Cornette Bowl. Mark Lamond is the president and CEO of Shoe Carnival and has served on St. Mary's Foundation Board and currently serves on the St. Mary's Health System Board. He and his wife Sharon live in Newburgh with their son Morgan.
I had no idea what was involved in the whole process of trauma. I immediately thought of an emergency room. It's so much more than an ED or emergency department process. It involves neurosurgeons, it involves orthopedic surgeons, it involves nurses, it involves people involved in rehabilitation. It even involves the clergy from a pastoral care. It totally amazed me that every function within the hospital was included in this thing called trauma care.
I grew up 2 blocks from St. Mary's, lived there until I got married. I was born at St. Mary's. My older brother and sister were both born there. So my family especially has this great comfort level with St. Mary's. The fact that they are now a level 2 trauma center just seems natural. It's such a comfort to all my family, all Mark's family, all our friends that is there for us. Hopefully we'll never need it, but it's just good to know that there's something like that in Evansville, that we can depend on them, as I always have. Mark and I are honored to chair this event that honors the St. Mary's Trauma Center. And you're about to see a video of a 16-year-old girl who was terribly injured in an automobile accident. And this kind of hits home for Mark and I because we have a 15-year-old son who's going to be driving next summer. And the thought that this could possibly happen to him or his friends or his teammates or anybody's child or anybody's family member is really close to our heart now that we know more about the trauma center.
I was at a friend's house and we were about to leave because she was staying the night with me that night. And it had been raining all day and it had just stopped, the roads were still wet. And we got in our car and started traveling down Airline Road behind County High. And we got about halfway down the road and I don't know if it was water or what we hit, but we hit some object in the road. And my car started fishtailing. And my side, I held on tight to the steering wheel and told her to hold on. So we were about to flip. I knew I couldn't control it, and my side of the car went off into a ditch and smashed up against it. And I remember flipping like over and over, watching ground, sky, ground, sky. I remember when we stopped flipping, I could feel like the seatbelt and how tight it was. And my legs was hanging out of the car, from my waist down was out, and the rest of me was inside.
Henderson 911, where's your emergency?
Yeah, I live at 8612 Airline Road. I'm exactly 3.5 miles off 41. Somebody just flipped the car right across from my road.
Okay, is there any injuries? Do you need an ambulance?
I can bring them in the car.
I'll get them on the way.
Right.
Can you tell me how many's hurt?
Oh my God. Oh my God, hurry up.
All right, we're getting them on the way. Stay on the phone, don't hang up, okay? Don't hang up.
Hey, I got your hand, okay? Oh my God. Hey, I got 911. They're on the way.
I kneeled down to talk to her and she was in pretty bad shape. She said, please stay with me, please stay with me. So I just stayed there with her and she started crying and a friend was crying and it kind of tore me up. And I just hated to see somebody so young with their whole life in front of them, you know, laying there in the situation that they was in. And I just hope and pray that I never have to see anything like that again.
When I first saw the scene, it was like a lot of car accidents I've seen over the years. I knew it had potential to be very bad. So I saw the vehicle upside down, but I was told that there were possibly 2 patients, and my partner went to the primary patient, I went to find the other patient. I found the other patient. I transferred her care to another ambulance crew where they continued that care and assessed the patient further. By the time I got back with my partner, the patient had been moved from the actual car to the ambulance, and care had been started, and my partner looked at me and said, "I am ready to go to the hospital."
When I arrived on scene, I remember pulling in and lights everywhere, didn't know what to expect. I ran up to the car was upside down on its top, and Della, the other little girl, was she was on the stretcher. They put her back on the stretcher, and then they was coming out with Cassie, and you know, the whole world was upside down then. And it, you know, I could see her bones sticking out of her leg. Her arm was broke. This leg was turned sideways. Her head, blood all over it. I couldn't see the belly part at that time. I didn't know what kind of ab injury she had. But I ran up to her and she had told me. She had said, "Dad, I'm sorry." I said, "Don't worry about it." So we jumped in the ambulance, and I rode the ambulance with her.
I come home from work that night and come in the door and the phone rang. And it was Cassie's dad telling me she had been in a bad car accident. He told me that the people who found her said it was pretty serious. When Cassie came into the emergency room at St. Mary's, it was just unbelievable because the trauma team, everybody was right there around her all at once. She had plenty of people right there to take care of her. I've never seen as many doctors as she had around her at one time.
The evening of Cassie's accident, I was the trauma surgeon on duty. When the page went out for the 911 trauma, I was in the ER waiting on her arrival. We knew that she had injuries to her chest and to her abdomen, and it was our job within the next 2 to 3 minutes to determine what things were life-threatening. After a brief time period, I was able to complete a thorough examination, review the data, and also review all the CT scans. And it was at that point I determined she needed immediate and urgent surgery.
I remember Dr. Burry, actually, he came out and he had talked to me just a brief second, said she's bad, you know, she's her aorta, she's got to go immediately to surgery, she's losing blood. So, whatever we got to do, let's do it.
Cassie's injuries included facial lacerations, a collapsed lung, a spine fracture, a tear in one of the large vessels supplying blood to her heart, a kidney injury, both thigh bones were broken, and her left arm was broken. She also had significant internal injuries to her abdomen.
Although I'm comfortable doing trauma surgery, I knew that I needed some assistance from one of my vascular trained partners, and that's when I called Dr. Shinnerl.
From her CAT scans, we could see that she had a tear on the inside of her abdominal aorta, the largest artery in the body. Our concern with that is that the injury may lead to an occlusion of that artery, which would put her at risk of severe complications and possibly even death. In the operation, we exposed her abdominal aorta. We controlled the aorta above and below the area of injury to get rid of the blood flow while we worked on the artery. We opened the artery up and identified the area that was injured and repaired it surgically. And then we closed the artery, and she did well after that from our vascular standpoint.
After about 6 hours in the operating room, we were able to complete all of the repairs that were life-threatening. That included, of course, repair of the abdominal wall, which had been divided and devascularized. We were able to repair the aorta. We were able to place a chest tube for injury to her chest, and we were also able to have Dr. Gable assist with debridement and closure and repair of the femur fractures.
Dr. Shinnerl and Dr. Burry had basically a life-saving situation on their hands, and due to the length of time that she was in the operating room, they really didn't want me to spend the 5-6 hours, whatever it was going to take, to definitively fix all of her orthopedic injuries. So we addressed the open femur fracture and irrigated that, put her in some traction, and then put a splint and did a closed reduction of her elbow injury. And within, I believe it was 16 to 18 hours, we were then able to take her back surgically to again repeat the irrigation debridement process on the open fracture, and then we're able to definitively fix them with intramedullary nails that were placed through the knees. And we took her back, I believe, another 24 hours later, and were able to fix the elbow.
When Cassie came out of surgery, she was transferred to the trauma intensive care unit. As soon as she arrived, she was hooked up to a mechanical ventilator, and something went wrong. The trauma surgeon realized that there was something happening with her oxygenation. Cassie was in troubles. They were afraid they were going to lose her. Therefore, the trauma surgeon decided to call a stat consult for a pulmonary critical care doctor. When I got the call, I was just arriving to the hospital. I right away went to the trauma intensive care unit and I evaluated Cassie. She was in trouble. Her oxygen was low, her blood pressure was also decreasing, her heart rate was very high. She looked incredibly uncomfortable. After a quick evaluation of the mechanical ventilator, I decided that I needed to take a look inside of Cassie's lungs. I used a device called a bronchoscope. I found out a large amount of secretions. I cleaned them out. I removed all those secretions and right away she was breathing much better. Her oxygenation improved, her blood pressure, all her vital signs went back to normal. After a quick review of the secretions, I realized that what I had was a large piece of chewing gum. She probably was chewing gum when she was involved in the car accident.
We were relieved that all of her life-threatening injuries could be addressed and repaired at that time in the operating room. But as we described to her family, this was just the beginning of a very long road of multiple surgeries in the future.
Cassie's initial injury and the subsequent operations to fix some of her other major injuries left her with an opening of her abdominal wall. It was approximately 12 inches by 6 inches in which she had no muscle, no skin, or no fascia between her intra-abdominal contents, her small intestine, stomach, liver, and the outside world. That's where the trauma service contacted me as a plastic surgeon to come in and help to close that defect. Cassie had a unique injury to her abdominal wall that actually resulted in part by the use of her seatbelt. The seatbelt, while it held her into position and kept her from flying out of the car, exerted an extreme amount of force right on the soft tissue of her abdomen. Wearing her seatbelt, while it did contribute to this injury, also saved Cassie's life, and I believe without her using that seatbelt, we wouldn't be here today talking about Cassie. Today, Cassie is doing very well. She has completely healed all of her wounds and has been left with a moderate-sized ventral hernia that will require additional surgeries to repair.
Nurses are such a vital part of the trauma team. They spend 24 hours a day, 7 days a week with the patient and know the ins and outs of every patient, are very aware of what's going on with the trauma patient. Cassie is such a sweet young girl. She is really soft-spoken, really soft-hearted. She was always happy to see a new face or speak to someone new. She was also beginning to become more and more emotional each day, realizing the changes that the accident was going to have on her, how it would impact her life, how it would impact her life as a teenager, the things that she had done before. She was realizing that maybe some of those things she wouldn't be able to do again. So a lot of her care at this time was also very emotional care.
As part of the trauma services team, the clinical psychologist is there to provide hope and reassurance for both patients and families during a time that's often very tumultuous and uncertain. My job was really to, again, provide her with a lot of reassurances that things were really going to get better and that through hard work she had every reason to expect recovery.
Dr. William Milliken is a general surgeon with Evansville Surgical Associates. He came to St. Mary's 9 years ago with a vision of creating a trauma program to serve the needs of the tri-state region.
Trauma Center at St. Mary's evolved because there was a need in the community. Patients are injured in Kentucky, Illinois, as far away as Vincennes, and within 100 miles of Evansville frequently come here. They're carried by aerovac systems to our trauma center because we're the only trauma center between here and Indianapolis and Louisville and St. Louis. So we are a trauma center that really affects geography well outside Evansville. And during the last 5 years, St. Mary's has evolved to become one of the leading level 2 trauma centers in the Midwest. And what we've achieved here, I think everybody at St. Mary's, as a real surgical, can be very proud of. I think we deliver care not only to adults, but more specifically to children that is excellent with regard to trauma care.
Part of the evolution of this vision has been the weekly trauma rounds. Every Thursday morning, members of the trauma team meet to review the trauma cases and develop a plan to address care concerns from the previous week.
Trauma rounds are important for many, many reasons. One, it brings together the expertise of not only the physicians, but probably more importantly, it gives an opportunity for our greatest patient advocates, which are the nurses, to play a role in their active care. It also brings together the expertise of people that are not physicians and nurses, the people in occupational therapy and physical therapy, infectious disease, pulmonary medicine. And all these people discuss each trauma patient completely, every aspect of their care, not only their mechanical care by the surgeons, but their psychological support by our psychologists, by all the different members of the team, by our rehab physicians. So it is that arena where the entire patient, not only their injuries, but their psyche and their emotional needs are addressed, and every single person on the team in the trauma center has an opportunity to speak to that patient's care in one time and place.
The trauma rounds utilize state-of-the-art technologies, such as a computerized imaging system called PACS. PACS allows the team to review X-ray, MRI, and CT images for each patient. Trauma specialists provide care for each trauma patient from the pre-hospital phase through hospitalization, rehabilitation, and recovery. Cassie is well on her way to recovery, thanks to the extensive rehabilitation services she's received.
When I first saw Cassie, we was having to use a walker with a platform because of her arm, and she had to have a lot of assistance with her balance. Her knees were very wobbly underneath her, and today she's walking without a device like a normal 16-year-old. There was a couple of times where she thought she would never walk again and never be normal, and through therapy and the different disciplines here, we worked with her. She realized that, yes, I can do this. With the trauma team, with all the different doctors and the nurses, we work together as a family to help with Cassie.
The Trauma Center at St. Mary's helped me because they all came together to make sure that I didn't get any worse than what I was, that everything that I did was pretty much the way it needed to be, to where I didn't hurt myself again. I appreciate everything they've done, and if it wasn't for them, I don't think I'd be walking right now. The way I look at it, they're the ones that saved my life more than anybody, and that I appreciate everything.
This girl moved rapidly from the scene of her accident, was evaluated very rapidly in the emergency clinic. She was in the operating room within a very short period of time. She was operated by myriads of people quickly. She had life-threatening injuries, which if they weren't addressed quickly would have killed her. Then she moved to a different phase because of other injuries requiring the expertise of other surgeons. She was seen by multiple physicians. The expertise of each was required. And that definition of multiplicity of surgeons all working together on a given patient is what defines a trauma center.
Henderson 911, where's your emergency?
Yeah, I live at 8612 Airline Road. I'm an exactly 3.5 miles off 41. Somebody just flipped the car right across from my road.
Okay, is there any injuries? Do you need an ambulance?
I'll get an ambulance.
I'll get him on the way.
Right.
Can you tell me how many hurt?
Oh my God. Oh my God, hurry up.
All right, we're getting him on the way. Stay on the phone. Don't hang up, okay? Don't hang up.
Hi, I got your hand, okay? Oh my God. Hey, I got 911. They're on the way.